Hello, everyone. Dr. Stillman here, and today we are going to be talking about vitamin D and how you should get yours. So, as always, this isn't medical advice, and make sure that you're following my Telegram and Substack channels. There's now a paid Substack option for those of you who would like to fund the care of those who cannot otherwise afford integrative medicine. And without further ado, let's get into talking a little bit more about vitamin D. So if you know me, you know that I love talking about vitamin D. I think it's incredible. I think it's fascinating, but I also think that it is very misunderstood and or underappreciated even by people in the integrative wellness space. I see this as partly being driven by the fact that so much money can be made from prescribing vitamin D supplements. Many people hear a statement like that and immediately think, well, this has got to all just be about making money. And if I just get some sun and take some fish oil or eat some fish or whatever, I'm sure I'll get my vitamin D. That is also not true. Just recently, I had a patient telling me that, oh, my vitamin D is always low, so I'm taking 10,000 international units a day. We have to ask very clear questions about, for example, could that vitamin D be hyper converting over into active vitamin D? Because you can see that. And if you're fueling vitamin D levels that are super high in the active portion, you could arguably wind up with a bad outcome. I have seen hypervitaminosis D or vitamin D toxicity in clinical practice. It does happen. And I want to talk a little bit more today with you all about how to think about vitamin D so that you don't make mistakes in how much you get, because obviously, you still want to make sure that your levels are adequate. Starting out with Diet, Sun, Lifestyle as Determinants of Vitamin D Status. This nice paper from the Annals of New York Academy of Science. It's pretty simple. Sunlight exposure, nutrition from things like full-fat dairy and fish. They talk about food fortification. A lot of you may not realize that vitamin D is being added to a lot of foods. I'm very skeptical of the forms that are being added, but it will have some contribution to your total load. And then supplements obviously are talked about most of all in the medical community as the way to get your vitamin D. One of the things I want people to know is that even in places like South Florida, you can have vitamin D deficiency despite getting adequate sun exposure. In the 99 subjects who returned for the end of summer visit, this is a study where they did a before and an after vitamin D levels, they found that the mean 25-hydroxy vitamin D concentration was 31 in men and 25 in women. Those people are low to borderline low. I've heard different experts opine that it's better to be at 35 or 40 or 50 or over 50. Personally, I'm looking for a level between 35 and 50. There's a lot of variation in here. What you've done recently will matter. The season of the year matters. Dietary choices matter. What you really want to avoid is leaving it lingering too low for too long. And this is one reason why I'll often check a vitamin D level more than once a year and use some combination of supplements, sunlight, and then also vitamin D producing UVB lamps in order to support patients' levels. So the seasonal variation that they found in this study is a 14% summer increase in 25-hydroxy vitamin D concentrations in men and 13% increase in women. That's a very big shift, right, for these people in this seasonality, right? Many people with a 10% shift will be normal in the summer or late summer, early fall when the levels are peaking. And many of them will end up being deficient in the winter just with that 10 to 13% drop. And I want you all to understand that that's happening in a place like Florida. This is going to be more extreme as you go further and further and further and further north. This is another paper that talks about vitamin D status despite abundant sun exposure. So in this study, they were doing this in Hawaii, and that's at 21 degrees latitude. That's actually the most southerly portion of a US state. Florida is the high 20s to low 20s. I think Hawaii is lower than Florida, but I could be wrong about that. And they looked at these people who reported that their sun exposure, and these are healthy people, normal body mass index, et cetera, their sun exposure was 28.9 hours per week. That's an enormous amount of sun exposure. That's 3 or 4 full days at the beach. That's incredible. Hardly anyone today actually gets that kind of number. What did they find? The mean 25-hydroxy vitamin D concentration was 31. That's remarkable. 51% of the population, therefore, had low vitamin D status, and the highest level was 62. I never see higher than the 60s in people who are not taking supplements. So, normal, natural, achieved in nature is somewhere between 30 and 60. I want to point out that the only places where people live that are very cold and don't have an abundance of ultraviolet light, those places and those people all compensate for this by eating enormous amounts of fish. And that means that if you combine low vitamin D status due to lack of sun exposure by living in a place like Canada or Minnesota, and you don't compensate for it by eating fish, that's one reason why life expectancies are dropping in the Western world. People have forgotten this very important connection. I always check vitamin D levels in patients. I don't always do it right off the bat because there are a lot of other factors that you actually need to correct before you correct this. And I also want to be talking to them about their lifestyle and their sun exposure and all kinds of other stuff before I jump into this with them. So those are my thoughts on vitamin D adequacy, sun exposure, diet. If you go look in the literature, it's very hard to get to a normal vitamin D with just fish. You need the sun. Unless you're eating absolutely ludicrous amounts of fish. And then you might wind up in my clinic wondering why you have mercury poisoning. So as always, thank you for watching. Make sure you're following my Telegram and Substack. Take care. Have a great day. If this video has been helpful to you, make sure that you check out my link tree below to find out how you can keep in touch with me best. And if you would like to become a patient at my practice, please apply to work with me at stillmanmd.com. Thank you again for watching. Have a great day.